All right, Katie, why don't you go ahead and we can get started.
Okay. Well, hello everyone. My name is Katie. I do community outreach for Old Friends Club. And Old Friends Club is, if you haven't heard of it before, we offer daytime memory care and caregiver respite. So we bring affordable active social clubs for people living with dementia in Western Washington. We have 5 clubs. They've been closed since, the pandemic started last year, but we are currently starting an affiliate program, so we hope to expand the clubs into different areas in King County. So really excited to be here. Appreciate everybody joining and really look forward to this presentation. So thank you so much to Megan and the Washington Poison Center for having this presentation and sharing this material with us. We're really excited about it.
Great. Thank you, Katie. Well, welcome, everyone. Hope you have all had a great day so far. I'm joined here by Han, who is one of our pharmacists at the Washington Poison Center. I am one of our public health educators located here in Western Washington. I'll give Han a little bit more robust of an intro a few slides on, so hold on for that. First, we just want to go over a little bit of housekeeping. So we are recording today's webinar, and I will send that out in a follow-up email in the next couple of days. You will see that there are all of the materials and the slide deck for today uploaded into the materials section on your control panel, but please just pop in the chat box if you have any issues accessing those, and I'll be sure that those are sent out in the follow-up email as well. We are going to have you all stay on mute today just because we do have a pretty good amount of material to move through, so we want to be sure that we get to all of our content. But please, please ask any and all questions that you have. Just type them into the chat box. I'll be monitoring that, and I will make sure that Han sees those questions and that we get to all of them. I think that's everything, so we can go ahead and get started with our brief agenda for the day. We are going to start with just an overview of the Washington Poison Center, who we are, what Han's job is, how we can help people, and then we're going to dive into some of the common poison hazards that older adults can encounter within their homes. So we'll talk about medications, we'll talk a little bit about household cleaners, and then I know this is a specific interest, especially for folks affiliated with Old Friends Club, and talking about how to help poison-proof homes of older adults with dementia or more advanced memory care needs. So we have a short little section on that. And then we'll round out with another section on the Poison Center where Han is going to walk us through what it is like to call her and her colleagues in our call center. So we will go ahead and get started. Remember, pop any questions that you have into that chat box. So first, I want to get us all on the same page on what I mean and what Han means when we use the word poison. For us at the Poison Center, it is a very, very, very broad term. It can really be anything. Any sort of substance can be harmful if it is used the wrong way, by the wrong person, or in the wrong amount. So that is going to apply to a lot of what you would traditionally think of as a poison, like those household cleaners, bleach, chemicals. But it also applies to a lot of other stuff: flowers, plants, berries, drugs, medications, alcohol, fumes, vapors, snake bites, insect bites and stings. Really, the list just goes on and on. So we at the Washington Poison Center, we have been in existence here in Washington for over 60 years. And we are one of 55 poison centers in the United States. We have 2 primary services. There's public health education, which is what you all are participating in today. And then there is our poison helpline, which is really our bread and butter service. So this is our poison helpline number. It is a national toll-free telephone number. You can call this number from anywhere in the United States. You will be routed to your local poison center. All poison centers are free. We never ask for insurance information. We're never going to send you a bill. We are also always open 24/7, every day of the week, every day of the year. Even during the pandemic, our hours have not changed. We are always here ready to help. Our services are completely confidential. HIPAA laws apply to us as well. And if English is not your preferred language, we have access to interpretation in over 260 languages. So this is where I get to introduce Han, who is one of our specialists in poison information. So she works in our call center, and I will let her explain what a spy is and what her role is. Go ahead, Han.
Hello, everyone. Thank you, everyone, for coming, and thank you, Megan, for inviting me. So I am a pharmacist at the Washington Poison Center. We also have nurses, other specialists, and on-call board certified toxicologists that work with us. I've been working at the Poison Center for almost 2 years now, and we have other staff who are celebrating their 40 years of working here. So we are certified in poison information. We take a big test every 7 years to stay certified. I really enjoy what I do, so every day I get to apply what I learned in pharmacy school along with what I've learned while working. This job keeps my brain active because critical thinking is required through most cases and calls.
Perfect. And speaking of those cases and calls, we wanted to share a little bit of our data with you so you can get a general picture of our call volume, what Han and her colleagues handle in our call center. So last year in 2020, our call center staff managed over 67,500 cases that involved more than 138,000 calls. So you'll see that there's a difference there in numbers between calls and cases. That's because a case or a patient is an easier way to understand that. A lot of times they're going to involve multiple calls. It might require a couple calls to treat them, or our call center staff might call to follow up to check on how they're doing. So that's why there's that difference in numbers. Now, Han, can you tell us a little bit about who calls the Poison Center?
Yes. So about almost half of our calls are concerning children who are under 6 years of age. Kids around or under this age are very curious, and they tend to get into a lot of things. We're not just for kids. We also get calls from teenagers, adults, older adults as well. And those calls tend to be more serious, mainly because the substances and the amounts tend to be greater of concern.
Great. And where are those calls coming from?
We get calls from everywhere, homes, chemical exposure from workplaces, schools, school nurses, prisons, places like swimming pools, parks, grocery stores. Medics or ambulance call us either en route, on scene, or 911 dispatch to see if patients should be transported to the emergency room. Pretty much anywhere an exposure can happen. We also get calls from the emergency departments, healthcare providers from their clinics, urgent cares, doctors, nurses, nurse practitioner, pharmacists, everyone.
Everyone. Great. And I think it's about a quarter of our calls are from healthcare providers. So we're here to talk today about older adults specifically. So I have some of our data from 2020 up on this slide, which shows the top 4 exposure reasons for older adults. The number one, that is always number one, no matter the year, is medication errors. So Han will explain to us in just a couple slides what those medication errors are. Then second most common is accidents, and these are typically going to be with non-pharmaceutical substances. So we'll talk a bit about those today as well. Then there are intentional exposures. So these could be self-harm, suspected suicide, intentional misuse of products or abuse of products. And then the fourth reason there is adverse drug reactions, which we're not really going to cover today, but we have a lot of medication-related materials on our website and a lot of other trainings that can cover that further. So, Han, we've seen a big increase in calls for really every age group this past year during the pandemic. And even in older adults, we've seen a pretty significant increase as well. So can you tell us a little bit about, why this time period is so risky for older adults with poison exposures?
Yes. So with COVID-19, elder patients have higher risk of severe illness. Therefore, it's crucial to increase precautions. A lot of us are having new daily routines, and that can sometimes remove memory cues that you might have had. That can make it difficult to remember when to take your medications. And the stress of isolation and meeting basic needs may decrease focus when taking the medication. Being distracted can lead to taking the wrong dose or the wrong medication. And then also there are a lot of rumors and misinformation about different substances to try to prevent or treat COVID-19, and that can lead to poison exposures. And then for anyone who previously relied on a caregiver for medication assistance, they may need to be more independent during isolation. The caregiver or the family member may not be able to go into the older adult home as often or at all.
Excellent. Yeah. And we also just, this isn't listed on the slide, but should be, but we also just have a lot more products in our homes. We have a lot more cleaning products, a lot more sanitizers. Potentially people were buying more medications or getting greater quantities of their medications so that they didn't have to go out as often. So that can put us at risk as well. So speaking of medications, this is the section we're going to start with first, and we will have Han give us a basic definition of what medication errors are.
Yep, so medication errors can be described as 5 wrongs. So taking the wrong dose, that might mean you may have taken 2 tablets all at once instead of taking 1 tablet 2 times a day. The wrong medication, that can be that you've taken ibuprofen instead of Tylenol because the bottles look alike. And the wrong person, usually that's if you've taken someone else's medication or your pet's medication on accident. And then the wrong time, usually the medication are taken too close together. You were supposed to take this medication at 4 p.m., but you took it at noon instead. So that can be too close. And then the wrong way might be taking the medication by mouth that was supposed to be applied topically. And then out of all of these errors, the most common errors in older adults are wrong dose, medicine, and wrong person highlighted in the blue box there.
So we get asked this question a lot on why medication errors are so common in older adults. And there isn't really one answer to that question. There are a lot of different reasons why medication errors can be so prevalent among older adults. So first and foremost is that older adults tend to take more medications than other age groups. They have more health conditions that require the use of medications. So they just typically take more. Then on top of that, they also have to follow some pretty complex care plans. A lot of older adults, they take multiple doses of multiple different medications that have been prescribed by multiple providers. So it creates this very confusing, very convoluted, unclear picture of what an older adult's medication plan is, all these steps that they need to follow. It can be very easy to make a mistake within that. And then finally, older adults are going to experience some age-related changes. It is a fact of life. There are physical changes like worsening vision, which can make it hard to read those medication labels. There can be loss of grip strength, so someone might not be able to open their pill bottles as easily anymore, which might lead them to place their medications out in a bowl or just not in any sort of container. Sometimes older adults have difficulty swallowing, so they might end up cutting or crushing their medications, which isn't always a good thing to do depending on the medication. And then there can be cognitive challenges, dementia, or just normal age-related cognitive decline. And finally, the way that a person's body reacts to a medication can change as they age as well. So that can lead to more of an adverse drug reaction. Alrighty, so Han is going to talk about medication errors by giving us some common caller scenarios. So go ahead, take it away.
Yes, so wrong dose is I've had so many cases on the wrong dose. Almost every day we get many calls on these. So I had a case 3 days ago, for example, where a 72-year-old female got a prescription for liquid amoxicillin. It's an antibiotic medication. She misread the directions on the label and took 15 milliliters every day instead of 5 milliliters. And she did this for 4 days. So she was running out of her medication a lot sooner than expected. So she realized that she took triple dose and then called the poison center. So sometimes double or triple dose are worrisome, and the other times they're pretty well tolerated. So we usually ask questions to determine whether the amount is going to be a problem or not, whether they can stay at home, monitor the symptoms, or go to the emergency room to be evaluated. So this is pretty common for us. And then wrong person is another common call that we get to. I had a call where a gentleman was holding his dog's medication, carprofen tablet, which is a pain medication for pets. He was going to give it to his dog. He went to the kitchen, got distracted, and then accidentally popped the tablet in his mouth. So we get calls like this pretty often, and a lot of the times they accidentally took them spouse's medications too, so thinking that they were their medication. And then last night I had a caller who took his wife's blood pressure medication, and he is on a blood pressure medication himself. So now he's got a double dose of blood pressure medication. So yeah, those calls are very, very common for us.
So there are, thankfully, a lot of great and very easy ways to prevent having to call Han or any of the rest of the call center staff with those types of errors. So Han will walk us through some of those now.
Yes. So when you're on more than 2 medications or a lot of medications, especially elderly patients who have difficulty managing the medications, and older adults are often taking multiple medications for multiple conditions, like Megan mentioned earlier. We call that polypharmacy. And the more medication someone's taking, the higher the risk of taking them incorrectly. So older adults, 65 years and older, they end up in the emergency room because they don't take the medication, they take them incorrectly, or they forget to take them. And if you do have dementia or other cognitive impairment, then we're worried about, are you really taking your medication, or are they really able to manage their medication, or are they taking it appropriately? So ways to help you or those patients stay organized with the medications are to have medication checklists, calendar, cell phone reminder apps. MediSafe is a free app, so you can use that. And then pill organizers are actually nice too. Getting your medication bubble wrap doses can be really helpful for some patients. You can request this at your local pharmacy to have your medication bubble wrap too. So pill boxes are another nice option. You can pick them up in your local pharmacy after you pick up your medication, set up a couple weeks in a box that has morning slot, evening slot, sometimes even noon or bedtime slots too. Then all the patient has to do is just to remember to take the medication from the slot. And if that's a problem, then electronic medication machines have alarms, and believe it or not, talking clocks. And just a reminder, pill boxes are not child resistant. Children can pop these lids off really easily. There's nothing to slow them down, which can be very dangerous. So it is very important to keep these boxes locked, out of sight and out of reach.
Excellent. Thank you, Han. And I realize I should have put this on this slide, since we are talking specifically about older adults with dementia or cognitive impairment. Han briefly mentioned the electronic pill boxes, and there are some really wonderful options that can provide quite the array of support to someone. There are some that will lock until it is time to take the medication, so that can be good if it's someone who's really prone to double dosing. There are others that offer visual cues, so they'll flash lights or they'll have audio cues. Some will even phone a caregiver if someone has not taken their medication at a certain time. So these boxes, typically you need to work with some sort of care organization to access them because they will require a data plan, but they can be a great option for someone who needs a bit more support with their medications. Alrighty, Han, medication lists. Let's talk a little bit about that.
Yes, so I would encourage everyone to use a medication list. So including your prescription medications, over-the-counter, vitamins, supplements, other substances that you use. So it keeps track of what you're taking or no longer taking so that you stay organized with your medications. So this is helpful when you go to see your doctor, when you talk to your pharmacist, or if you had to call the medics to come to your house and can quickly help you by knowing what medications you're on. And if you have to go to the emergency room after falling, they want to know what medications you're on. So having it readily available is important, and it can save a lot of time. And also healthcare professionals would want to know what medications you're on so that they can see if it might interact with your other medications that you're taking. And it's also for us at the Poison Center too when you call us. So for each medication or substance that you're taking, we want to include the name of the medication, the milligrams strength or dose, what you're taking it for, time of the day when you take them, and then note any special instructions.
So if you don't already have a medication list or you need to update your medication list, we have some materials that I've uploaded for you today. There is a medication list development guide, which walks you through a series of questions to help you figure out what all needs to be on there and what correct information needs to be put on there. And we also have these medication list templates, like is on this slide. Our format is a little bit different. We have one worksheet per medication. That way, if your medication changes, you don't need to rewrite your entire list. You can just take that sheet and toss it and get a new one, whatever you need to do. All right, Han, reading labels.
Okay, so I've talked about a lady who read her medication label incorrectly and the wrong dose earlier. And this is an example of an over-the-counter medication, and you can actually overdose with these too. We get a lot of calls about them. And then for this past weekend, for example, there was a 60-year-old man was taking Dayquil, and also he took some Excedrin migraine. And then both of these products have acetaminophen, which is Tylenol in them. He didn't realize he was taking an abundance of acetaminophen. So, and then this is pretty common. Sometimes patients are on taking Tylenol or acetaminophen along with their cough and cold medication, and they don't realize it. So I encourage everyone to read the ingredients. And if we find the same ingredients in them, call the Poison Center. Or if you already took both products, or if you need to know what to take or how to take them, we're here to help you figure it out. And then be really careful with over-the-counter medications. A lot of times there's no one there to counsel you or tell you whether it's going to be a problem with your medication that you're already taking, or you're taking something that you should be careful with, like if you have kidney or liver issues.
And you brought up a great point, Han, of calling you if you're ever unsure. So you can always call the Poison Helpline if you just have a question. It doesn't have to actually be a poison emergency. You don't need to already have had the exposure. You can call them, talk to them. I don't want to put words in Han's mouth, but I have a feeling that a lot of times our call center staff prefer that, because hopefully that means that they are preventing something bad from happening later on. All right, tell us about these lookalikes.
Yes, so another thing that I like to go over is to add labels to look-alike substances. So substances like the ones on this slide here look a lot like each other. So the one on the far left side, we have Crest toothpaste, and next to it is a steroid cream, and then the one to the right of that. So if you're distracted or if it's dark and you can't see, you're likely to grab the wrong product. 2 days ago, I actually had a caller who brushed their teeth with a cortisone cream instead of their normal toothpaste, and another caller who instilled nasal spray into their eyes because they thought they were their eye drops. and then another woman who installed some super glue in her eyes, thinking that it was her eye drops too. So these accidents usually happen when the lights are out, or they put all of these products on their bedside table. So I would say to avoid putting any products on your bedside table to prevent or avoid these accidents. And then having some visual differentiation on these bottles too, like turning on lights and then turning on lights, putting on glasses when you're taking your medications can help prevent these accidents as well. Use markers, stickers, tape, or any other form of labeling to visually differentiate lookalikes. For example, between the eye drops or the ear drops, you can put like tape on the eye or the ear in large prints, or use a marker to make the cap different colors. And then Mr. Yuck stickers can also be used on label for potentially toxic or harmful substances as well.
And if you need any Mr. Yuck stickers, you can go to our website and we will send them to you for free. So a little bit about safe storage now.
Yep. So always keep your medications in containers, either original container or pill box. You could use different color bands around these bottles too to keep medications separate from those of other household members, or use labeling on them to make sure they're different, and store them out of sight, out of reach of kids, and keep them locked.
Yeah, so the same rules apply to medication bottles as well as those lookalikes. You can use markers to color caps differently. And this is if you have multiple medications of different people or even your pet. So the primary recommendation is to store them completely separately in a different drawer, cupboard, whatever. But that's not always possible. So if you do need to keep those medications together, just use some sort of visual cue that are different. They need to be fancy bands like what is on the slide. You could even just use rubber bands or color the caps. And then Han has said multiple times to lock up medications as well. There are so many different kinds of lock boxes that you can get, and we don't really recommend any specific brand or kind of lockbox. Typically, we will say, though, that you want something that is durable, something that has a combination lock instead of a key, just because keys can be easily lost or taken, so a combination lock tends to be a bit more secure. And then you don't want anything with an external facing latch, because those can be very easily broken. And that's really a concern if there's the potential for other people accessing your medications or a kid getting into them, etc. So there is a concern, especially for older adults, that locking up medications can make it more difficult to remember to take those medications. So there are a few different recommendations there to help maintain that adherence, to make sure you're taking your doses at the right time. You can potentially put something that you would commonly use with your medications, like your toothbrush. You're always going to brush your teeth, hopefully 2 times a day. So if you keep your toothbrush in that lockbox with your medications, then you have that cue right there. Or you can always keep a small amount of your medications out, like 7 days in your pill box. That way, it's just a small quantity that is out instead of having the entire bottle. Han, anything to add there?
Oh, you could cover everything.
We also recommend that you don't hang on to any unneeded, expired, or unwanted medications. When you hang on to these medications, it can increase your risk, or whoever in your household you're living with, it can increase their risk of taking the wrong medication, just mistaking it for something else and taking it. It can also put people at risk if they have others who might access their medications intentionally. So if you ever have something that's expired or unwanted, unneeded, you can go ahead and dispose of them safely with our state's very robust secure medicine return system. So there is a website. It's called takebackyourmeds.org, which is listed here on the slide. The Washington Poison Center actually runs this website, and on it we have all of the different medication drop boxes in the state. So these, they look like mailboxes. They're usually located in like grocery store pharmacies or Bartels, Rite Aids, healthcare clinics. Sometimes they're in police or sheriff's departments. They're always free to use. You just take your medications in a bag or whatever, and you pop them in that mail slot. They're never going to be accessed by anyone. They're taken out and they are incinerated. So it is the safest way to get rid of those medications. These drop boxes, you can take back really anything you need to. There are mail back options in some counties in Washington, but those tend to have more restrictions on what you can mail back. So this is still probably the best way to dispose of those unneeded medications. And here's our phone number one more time. If you don't have it saved in your phone already, I encourage you to do so. No worries if you miss it on this slide though, because it is on pretty much every single slide in this presentation. So give us a call if you ever have a medication error, or if you think maybe you could have, or if you just have a question about your medications. All right, we're going to shift gears now, and we're going to talk about household cleaners and disinfectants. So this has always been a concern for us at the Poison Center with older adults, but it has been even more so this year with the COVID-19 pandemic. Now, Han talked already about what COVID risks occurred for older adults, and definitely cleaners and disinfectants have been top substances that we are hearing about that older adults are exposed to. And so some of those top substances we get calls about for adults 60 and up are household bleach, hydrogen peroxide, and then other forms of disinfectants. So why is there this increase during the pandemic? We've covered this already, but people are using these products more. So because they're using them more, there's more chance that they're going to have an accident with them. This has been a really stressful year. There's been more than just the pandemic going on. There has been a lot happening. And when you're stressed or when you're anxious, you tend to have a lot less focus when you're doing things. And so it's easy to accidentally make a mistake. We've also heard about people using products that they aren't familiar with. I think this is less of a problem now than what it used to be, but back at the start of the pandemic, if you went into a grocery store, the shelves were just wiped clean of all cleaning products. And so when things were back in stock, people were just buying them, and they might not have been products that they were very familiar with. And if they didn't read those labels closely, then they could end up having an accident with them using the product incorrectly. And then finally, there have been so many rumors and so much misinformation floating around about ways to protect yourself from COVID. And a lot of those can lead to having a harmful exposure to something. So Han is going to walk us through some safety tips with those cleaners.
So when you're using those products, I would encourage everyone to wear gloves when you're using these chemicals or cleaning products. And then when you're using them, open your windows, doors to make sure that there's adequate ventilation. Read the labels thoroughly before using any of these. And then be sure to check if a product needs to be diluted, if it's already concentrated, or if it's ready to use. And many people think that using the product at a higher concentration than recommended is better. This can be dangerous. So more concentrated is not better or more effective. And then also only use the product as they are intended. And then there's a lot of cleaning products out there too that contain bleach. Bleach is a base and it can interact with a lot of products and can create harmful or toxic gas. For instance, when you add bleach with a vinegar, it can create a gas called chlorine gas, and then bleach with ammonia create chloramine gas, and bleach with rubbing alcohol create chloroform. And a lot of these can cause some respiratory effects and can be highly toxic. So be sure to check the ingredients of each product you're using to make sure that they are safe to use together. And a lot of chemicals have scientific names, so if you're unsure what is safe, please call us and we can help. Then since the pandemic started, we've been getting a lot of calls on how to disinfect everything, including grocery, food. We get a lot of calls where people spray disinfectant on their fruits before cutting them. Currently, there is no evidence of food or food containers or food packaging being associated with transmission of COVID-19. Like the other viruses, it is possible that the virus that can cause COVID-19 can survive on surfaces or objects. And if you are concerned about contamination of food or food packaging, wash your hands after handling these food packaging, after removing food from the packaging before you prepare for eating or before you eat. But I don't recommend using these cleaning products on food. Follow instructions or directions on label and only use them as they are intended. And then for cloth masks, everyone's wearing cloth masks nowadays. So I would encourage everyone to wash your mask frequently with soap and hot water. And please don't spray or soak or wipe your mask with cleaning chemicals or disinfectant. This can potentially cause some chemical burns on your face. The longer the chemical sits on the face or the skin, the more severe symptoms or burns that you have. So wash your cloth with just soap and hot water. That should be enough. So we're going to discuss about safe storage of chemicals or cleaning products. We get a lot of calls about accidental ingestion of these cleaning products almost every day. Many people transfer the chemicals or cleaning agent into a smaller container, so it's easier for them to kind of pour or access. So, for example, for the photo on the left of the slide, the Lysol cleaning solution color looks almost exactly the same as the Gatorade drink, and kids or household members would think it's Gatorade or juice or soda. So most of the calls we get, many of these bottles are not labeled or not labeled properly. So I would recommend to store these products in their original containers, or if you are going to transfer them into another container, then label them in a way that is easy to identify, have large prints front and back. The other day I had a caller who took a swig of a cleaner that was transferred into a juice bottle. It was sitting on a counter, but the label was facing the other way, and he thought it was juice. And then store these products up high and out of reach of young children.
And last thing in this section that we have to talk about because it's COVID is hand sanitizer. We have been getting so many calls about hand sanitizer, especially with little kids. So I'll let Han explain in just a moment what the potential harm is, what the risk is with kids in hand sanitizer. But first, I just wanted to point out that there are so many hand sanitizer products that are out there right now, and some of them have somewhat questionable packaging, I guess we could say, where it makes it really easy for kids especially to mix them up with something that could be edible. I think a very excellent example of this is the image on the far right of the slide, where they look just like those little fruit and vegetable puree packets that kids eat. But these are actually hand sanitizer. So that would be not good if a kid decided to eat that. So Han, can you just explain a little bit about what the concern is with hand sanitizer?
Yes, so we get a lot of calls where toddlers who drank some hand sanitizer, and in most cases, toddlers, they don't drink a lot of hand sanitizer when this does happen, since the taste doesn't taste very good. So usually it's pretty low risk. And like Megan mentioned earlier, these hand sanitizer contain some alcohol in there too. So a lot of them tend to have stronger concentration than most hard liquors, so they can cause similar side effects as if they drank some alcohol, and the effects are usually more severe depending on how much they consumed. Another thing that I like to add is there has been a sharp increase in hand sanitizer products that are labeled to contain ethanol, almost also known as ethyl alcohol, but have tested positive for methanol contamination. So methanol or wood alcohol is a substance that can be toxic when absorbed through the skin or ingested, and can be life-threatening when ingested too. So consumers have been exposed to hand sanitizer containing methanol or are experiencing symptoms should call us. And if you think you have one of those methanol-containing hand sanitizers, you can check the manufacturer or the name of it on the FDA website to see if it's a recall product. And if it is, then I would recommend to discontinue using them and then call the Poison Center.
Great. Thanks for bringing that up, Han. I'm going to hopefully have Alex, one of our colleagues who's on this presentation with us now, pop the FDA list into the chat box so you all can access it. If he can't get it, though, I'll be sure to send that out in the follow-up email. But with kids and hand sanitizer, if you think a child has ingested some hand sanitizer, don't wait for any symptoms to occur. Just go ahead and give the Poison Center a call right away. Here's that phone number one more time. Remember, 24/7, 365, completely free. So we have a short little section about poison prevention with kids. So Han, take it away through this.
So safely store your medications, keep those medications out of reach. And if your medications are in your purse or backpack, make sure that you safely store your purse or backpack and the medications, not just up high, but out of reach, in a safe spot and out of sight to any kids that might be in the household. A lot of my calls start with my child climbed up on the counter, got into the cabinet that was up high and got a hold of some medication. So kids like to climb, they can get into things from up high, so please lock up your medications. And like Megan mentioned earlier, that you can buy those lock boxes at your local drugstores or online.
And then you want to be sure that your purses and your backpacks are also safely stored away. I know we get lots of calls too from kids who have gotten into those, especially if they're visiting like a grandparent's house or someone else's house. And those purses and backpacks can contain a lot of different things, from medications to hand sanitizers to really all number of different substances. So then some medication-specific tips.
Yep. So we want to make sure to prevent any accidental poisoning in kids. Kids often mimic adults, so do not take a medication in front of them. So they see you taking your medications, they might want to be like you, and then also take medications and get into things that they shouldn't. So keep those medications out of sight, out of reach. Check your floors, carpets periodically, so for any dropped medication. The image on the slide shows medication that can look like candy. So a kid might not have an idea if it's a medication or Skittles, so it's easy for kids to just pop that in their mouth. They explore the world with their mouth, so keep medications or any toxic household items out of sight, out of reach of children, and in a child-resistant container. And just a reminder that child-resistant containers are not child-proof. They can figure out how to open them pretty quickly and easily. And I had a case the other day where a grandfather called because his 3-year-old grandson found his grandfather's blood pressure medication next to his bedside. And his grandson brought the bottle to the grandpa and said, "Candy." And the grandfather found some chewed up tablets, and he didn't know how many tablets this grandson ingested, and it was a dangerous blood medication too, so blood pressure medication. So we had to refer him to the ER for monitoring. So it's very important to keep medications out of sight and out of reach and locked.
All right, so we're moving on to really one of our final sections here before Han just walks us through what it's like to call the Poison Center. And that's to talk a little bit about adults with dementia or advanced memory needs. So really, everything we've talked about so far applies. I mean, it applies for every person of every age. But we did want to pull out a section specifically on these adults because for caregivers of adults with dementia or with memory care needs, there is a lot of responsibility placed on them to make sure that that older adult is staying safe and staying healthy. So please use all of the tips that we have already covered today. Utilize the Poison Center. They can be a great resource for you. And then we have another recommendation to help you, I guess, monitor or understand or potentially know if an error has occurred. Because even in the most poison-proofed homes, mistakes can still very much happen. It is so easy to make a mistake. So we're going to walk through a couple specific things to look out for and some key strategies that we recommend that caregivers use. So first, a really big question to Han. How do caregivers know if there's been an accident or a medication error?
Yes, so unfortunately, there is no easy way to know. The signs or the symptoms of someone depends a lot on the substance they were exposed to, as well as the accident or error was. For example, the symptoms of someone who double dosed on their blood pressure medication is going to be very different from the symptoms someone who accidentally drank a cleaning solution. Like a double dose of blood pressure medication can lower your blood pressure, so that can cause some dizziness, drowsiness, versus someone who accidentally ingested a cleaning product that can cause some mouth irritations or burns or blistering or drooling. So depending on what the substance or error is, they can be very different.
So essentially, there is no way to know. So what we recommend is that you become very familiar with what the older adult's baseline is. So what is their normal behavior? What are their normal reactions to things? Be very, very aware of that and understand what is normal, what is the baseline. That way, if there is a deviation, if there's a change in either direction, you know that something might be up, that something might have happened that you need to investigate further and discover what exactly is going on. Is it a medication error? Is there potentially a drug interaction? Are these side effects? Is this some other substance that's not a medication that's been ingested or used incorrectly? So any sort of deviation from that baseline can be telling that an accident has occurred. There are also a lot of other reasons why deviations can occur, though, so you can't automatically assume that it's some sort of poison exposure. But so we've talked a lot about medications here specifically. So it's really important to become familiar with the common side effects of a medication that an older adult is taking, to observe them as they're starting out that medication, as they're taking that medication, to see what their normal reaction is to it. What are their physical reactions to it? Are there any behavioral reactions that are common when they are taking this medication? And then is there anything outside of the norm of that you're seeing that's outside of that baseline? So Han, do you want to walk us through how to understand medications and the importance of that?
Yeah, so one way to understand the baseline of any adult is to make sure you understand the medications they're taking. So what the medication is, what it's for, how they take it, how long will they need to take it, and expected side effects, or what to do if they occur, and should they stop or not take the other medications.
So we provided this question sheet for all of you. It's uploaded into your materials, and I'll send it out again later in the follow-up email. But this is just 10 basic questions that you can take with you to those provider appointments or to the pharmacy when you are picking up a medication, to make sure that you really understand what that medication is and what to expect. So we did want to list out just a few general indicators that something might be wrong, but again, remember that seeing any of these symptoms does not mean that there was a poison exposure or a medication error. These can be signs and symptoms of a lot of other medical conditions or issues. These are just potential maybes if you see something like this happen. So Han, go ahead.
Yeah, so a lot of medications or things, plants or anything that can cause some mental status changes, so like sleepiness or excessive drowsiness. This could be someone taking a double dose of their Benadryl, or a child who drank some hand sanitizer that contains some alcohol in there. These substances can cause drowsiness, so kind of gauge what symptoms they're having, and then call us if you have any questions. And then muscle symptoms like rigidity, tremors, or seizures. A lot of substances like cleaners or plants or medication can cause some stomach upset, like nausea, vomiting, diarrhea, constipation. There are a lot of other symptoms such as dizziness, falls, changes in your vital signs like increase or decrease in blood pressure, heart rate, respiratory rate, oxygen saturation, and temperature. And then those are a few general indicators that something may be wrong. However, sometimes these symptoms can be delayed. Sometimes you won't know until hours or days later. So it's important to call us if you think or know an exposure or an error happened.
Excellent. And really, again, the bottom line that we want you to take away from this is first to know the baseline so that you can be aware if there are any changes there and if you need to get help from someone, but also to use these medication strategies that we talked about earlier to very carefully document on a medication list, list out all of those medications and their doses, double check it to make sure that it's accurate. Use a checklist or some sort of dose log. That can be very, very helpful to EMTs who might arrive on the scene, or when you're calling the poison center, that can be really helpful too. If you're ever in doubt, give the poison center a call. You are not going to waste our call center's time. They are there to help you, and they love doing that. It's their jobs. We will say though, if someone is having trouble breathing or if they are unconscious, please just bypass us and call 911 directly. Okay, last section here, and I do see we have a question in the chat box, but I think we can talk about that as we get into these final slides here. So Han is going to walk us through what to expect when you call her and her colleagues. And just first, a reminder here, call for anything. Anytime there's any of those 5 wrongs, there's an accident or reaction, or if you just have a question or are unsure about something. So first, Han, who can call us? Does it have to be the person who's having the emergency?
No, anyone can call us. So if you have a concern about yourself, your caregiver or your family can call us. We're not only a poison or drug overdose information or treatment help. We also are an advice, information, or resource line. You can ask about adverse side effects of your medication, drug interactions, and we can help with that. Or if you need a phone number to a medical advice line, we can also provide that for you as well. So yes, anyone can call us.
I hope you all have this phone number memorized by now. But this is, I think, a good point to bring up the question that we just had in the chat box. So Han, would you talk more about the help you can give with languages other than English? So what happens if the person who calls is unable to say that they speak another language?
Yes, so we will ask if you need an interpreter, and then you can state which language you like us to interpret or have an interpreter. Then we can connect you to the interpreter, and then we can ask questions, and then through the interpreter, and then they will talk to you.
Great, thank you. So if they're unable to understand your question on if they need an interpreter or understand when you ask them what language they speak, is there a way that you're able to easily figure that out and get an interpreter on the line?
Yeah, sometimes Spanish is easy to identify. Sometimes Mandarin or Chinese or Vietnamese, that can be easily identified. But yeah, sometimes people would just say the language that they speak without saying anything. So that helps a lot too.
Perfect. Thank you. Okay, so can you walk us through what it's like now to give you a call?
Yes. So in order to form an assessment or a recommendation, we will first ask you some questions like the age of the patient that we're talking about. We need to know the name of what was taken, how long ago it happened. It will make a difference whether you're calling about something that happened yesterday or 5 minutes ago. How much was taken, the amount really makes the poison, and a lot of times people call and have no idea how much was taken. So we usually ask more questions like how many are missing, was it new to begin with, how many were used, or how many are left in the bottle, and sometimes they can give me an estimate of or an exact number. And I always ask how the patient's feeling, and this can determine whether or not the patient can be managed at home or they need to go to the emergency room. So once we've collected all the necessary information, we'll tell you then whether it's safe for you to stay home or go to the emergency room. And in 2020, over 90% of older adults who called us first were managed at home. This is very important because this keeps people out of the emergency room or the doctor's office, keep them safe at home when it's safe to do so. And when they go to those emergency room these days, they have to worry about COVID exposure, and we can also save a lot of monies for the patient and the public for those emergency room visits. So it's important to call us. And when you are safe to monitor your symptoms at home, we tell you what symptoms to look for, sometimes how long you can expect those symptoms to arise, and then when you should call back or when you should be concerned. And if we advise you to go to an emergency room, we offer help, assistance to the emergency room. We tell them what symptoms to look for, how long to watch you, and if there's a treatment or an antidote available too. And then we follow up with the emergency room, and then we follow until you are discharged or until your symptoms are minor and we know that you're not going to get worse. And then depends on what exposures that was. We do a follow-up on patients that we leave at home as well as those we send to the ER. Sometimes we will be calling you back. Say if you accidentally injected a double dose of your insulin, we will be calling you back to trend those blood sugar and then your symptoms until the medication wears off. Or if we had a double dose of your blood pressure medication, sometimes we ask you to call us back, and we always end our call with, if you have any more questions or concern, we want you to call us back. So yes, we are here to help, and we love to help. It's our job.
Well, that is all of our slides for today. So thank you so much, Han, for joining us and for sharing all of your stories and all of your tips with us. It is 3:30. If people have questions, please go ahead and put them in the chat box. Han, I don't know if you need to hop back on the phone, so you are welcome to sign off, and I can handle any questions that come in, and people can also always email me too.
Okay, perfect. Thanks so much, everyone, for coming, and it's my pleasure to be here today. Thanks, Megan, for having me.
Thank you, Han. For those of you who are still here, you are welcome to place any more questions into the chat box. I do ask, I have a demographics questionnaire that I would really appreciate if you took a couple of minutes to answer for me. I'll launch that now. It's just to help us with some of our funding. They like to know who we're reaching with our education. So you're welcome to answer no questions. You're welcome to answer all of them or anything in between. Greatly appreciated. Thank you. And you are welcome to sign off once you finish filling that out, or please, I will stick around for a few more minutes if you have any questions. Alrighty, everyone. Here's my email address one more time. Thank you all so much for taking the time out of your schedules to join us today to listen to Hannah and I. It doesn't look like we have any questions, so I'm going to go ahead and end the meeting. And you all have a fantastic rest of your day, and be on the lookout for a follow-up email from me containing the slides and the recording. Have a great day, everyone.